Good morning. Let's talk about rotator cuff tears. A lot of people say rotator cuff tears, but it's actually rotator cuff, C-U-F-F, tears. What is the rotator cuff? The rotator cuff are four small muscles located around your shoulder, and they link together to form a cuff that literally sits on top of your humerus. It's beneath your deltoid, so you can't actually see or feel the rotator cuff. The purpose of the rotator cuff is to take all the energy or strength derived from the larger muscles, such as the deltoid or latissimus or your pec major or your chest muscles, and turn it into meaningful motion or rotational motion. So you can move the arm out, move the arm up, any way you want to place it in space. With time, sometimes with activity, sometimes with trauma, our tissues wear out. The vast majority of rotator cuff tears that we see in the office are attributed to attrition. Your tissues just wore out. Think of your favorite pair of blue jeans that you've had since high school, if you can still fit in them. Think about the knees on the front of your jeans. That denim just wore out. One day you felt the breeze and looked down and there was a hole there. A portion of your rotator cuff tissue is not very different than that. It goes through a process of degeneration, or something we call tendinosis, which you can look up on my website. And tendinosis can progress from degeneration to fraying of the surface, to a partial tear, to a full thickness tear where a portion of the tendon has detached from the bone. Now, there are also situations where you have a normal rotator cuff or a cuff with slight degeneration. You go outside, you play sports, you get tackled and knocked down, or you slip on the ice and fall on that shoulder, or as you're falling, you reach for something to hold on to it and you yank your shoulder. Those situations can cause acute traumatic ruptures of the rotator cuff. Is there a difference? Absolutely. Most of us, and I mean academic physicians, believe that attritional rotator cuff tears can be managed in the majority of situations non-operatively. That means with physical therapy or doing nothing if it doesn't bother you too much, occasional injections, etc. If those non-operative modalities are unsuccessful at alleviating your pain, and you have significant pain with use, or particularly pain at night when you're trying to sleep, then surgery is an option. Now, acute or traumatic rotator cuff tears are a different story. Those should generally be fixed. Again, not all, and once again, my disclaimer applies, and this is not medical advice, and you should talk to your orthopedist. But if you slip and fall and tear your rotator cuff, the likelihood of it being a large tear is fairly high. Those tears are, that tissue in your shoulder is not degenerative and has a very good chance of healing. Now, should it be fixed sooner rather than later? Probably. Why? 1, retraction. The rotator cuff is like a loaded rubber band. All right, imagine a rubber band between my two fingers. I release it on one end. What's going to happen? It's going to shoot over towards the other finger. The muscle is no different. If the rotator cuff retracts or pulls far enough away from the bone, it'll make the repair difficult, and the likelihood of a successful repair when all is said and done much lower. The other issue with waiting, fatty atrophy. Atrophy is simply, picture a leg that goes into a cast. You take that cast off in 4 weeks and that leg has shrunk. What has happened? The muscles have atrophied or become smaller. Now, what happens with rotator cuff muscles that are no longer attached to the bone? The body changes the muscle to fat. It's very cruel, because if you reestablish continuity of the tendon, it doesn't turn the fat back into muscle. So if you wait on a large retracted acute rotator cuff tear and that tissue turns to fat, then it doesn't matter if you get it fixed because you're fixing a piece of fat and it has no contractile properties and doesn't function as a muscle. Now, what do people with rotator cuff tears feel? Everyone thinks they need to have weakness or certain complaints. Most patients with rotator cuff tears simply have pain. That pain can be activity related, trying to reach overhead, trying to wash your hair. For women, trying to put on a bra. For men, trying to put on a belt, trying to reach back and pull something out of the back seat of your car. What brings the majority of patients into an office for small rotator cuff tears is night pain. You can't get comfortable at night or you're waking up at night. Large rotator cuff tears that encompass at least one or two complete tendons, again, we have four, will complain of weakness. They simply can't lift the arm up, or if they do, they can't lift it far. They can't lift something heavy. And it'll take an examination by an orthopedist and perhaps an ultrasound or an MRI to determine the actual size of the tear. X-rays may be useful to reveal changes that we can see in the bone that are secondary to rotator cuff disease as well. So, bottom line take-home message, do all rotator cuff tears need to be fixed, quote unquote? The answer is no. You can go much slower on these small attritional rotator cuff tears where the tissue simply wore out and try a course of therapy, injections, etc. Whereas you need to consider being much more aggressive with large, acute, traumatic tears after a significant incident or traumatic event. Any questions? Please feel free to post them in the comments. I'll talk to you soon. Bye.